This segment sponsored by GBMC Healthcare.
So we've all heard of physical therapy, and we also know that it's Breast Cancer Awareness Month. But did you know that the two subjects often go hand in hand? Well, here to explain more is physical therapist Christina Penny. Hi.
Hey.
How are you?
I'm wonderful. How are you?
Good. Okay, so tell us, how closely do you work with breast cancer patients to design a treatment plan that helps them benefit?
So there's lots of different ways that breast cancer treatment and physical therapy go hand in hand. So it's thinking about how do you manage things after surgery or with chemo radiation as far as improving strength and range of motion and getting them back to their daily function.
Okay, so do you think that people even realize that that comes along with the breast cancer treatment usually?
Not usually until they're actually going through these interventions themselves.
Right. And so then how do you work with the breast cancer patients to improve their health, their fitness, and then daily function?
It really depends on what their after effects are after treatment. So sometimes with chemo radiation, people have what we call neuropathy, which is where they lose kind of sensation or strength in their hands and legs, and we have to teach them how to rebalance themselves. You think about generalized deconditioning, where people are just a little bit weaker than they were before. And then we're thinking about upper quarter management with soft tissue injuries from like the breast surgery itself.
Okay, so can you kind of briefly outline the types of physical therapy treatments that are then geared toward helping the breast cancer patients?
Absolutely. So we're thinking about soft tissue management for the breast and scar tissue around those regions that they had surgery, sometimes in the rib cage or in the arm or shoulder. We're thinking about strengthening activities and range of motion to kind of normalize their upper quarter movement. And then we're thinking about generalized conditioning and balance training.
Okay, so let's talk about the breast cancer surgery, right? What are some of the side effects of the surgery that you can kind of help people manage with the physical therapy?
So pain is one of those things where you go in and you cut the breast tissue. There's pain associated with that injury. Scar mobility, improving strength in the upper body. And then we're thinking about just generalized functional activities.
Right, so how do the women kind of respond coming in and then getting help from you?
It's really beneficial because you know, after any surgery, especially cancer treatment, you're kind of a little low and a little down, and you really want to get back to your normal life.
Right. And so how, even before breast cancer surgery, how can physical therapy help?
So typically, breast cancer or physical therapy prior to breast cancer surgery isn't super common unless you have different comorbidities, such as, you know, maybe you're obese or a little inactive, or you have other kind of conditions that might make breast cancer surgery less optimal for you to function. And then we're thinking about prehab, just kind of increasing your strength and overall fitness.
Okay, so what is prehab?
So prehab is the idea that you're coming in for physical therapy to improve generalized conditioning, strength, and range of motion in those regions where the tissue is going to be affected. So someone who may have already a shoulder injury beforehand, for example, might need to do strengthening and stretching to like prior to.
Okay, so then if they have a mastectomy or some other kind of lumpectomy, the surgery, so then you would do it either on one side or both sides?
You typically do it on the same side that you have treatment on.
Okay, and so then what is the goal of physical therapy after the surgery and during cancer treatment, radiation, chemotherapy? And then how does it kind of help minimize the side effects?
So the goal ultimately is to get them back to their previous level of function. So we're thinking pain-free motion. We're thinking about getting them being able to reach up above their body the way that they used to be, and get them back to their normal function, whether it be that they've lost their balance after surgery and chemo radiation, whether they are you know, not as strong as they used to be. So it's all about getting them back to their prior level of function.
Okay, and is there a time frame?
No, because it really depends on the type of surgery that they had, whether or not they had radiation, whether or not they had chemo. So that's very variable per patient.
Well, still, it's super helpful to know that, you know, that's even there and an option. I had no idea. Okay. So where can people go to get more information about you and what you do?
So they can go to the GBMC rehabilitation website, and they can also go to the National Lymphedema website.
Okay, and I know we have all of that information there on our screen as well. Christina, thank you so much for joining us.
Thank you for having me.
All right, stay with us.